Tonight there is hopeful news for people with epilepsy.
A recently approved device can detect, even interrupt a seizure before the patient feels it coming on. CBS 2's Dr. Max Gomez reports.
My body stiffens up and then next thing you know, I start kicking around.
17-year-old Namdi Chukwuma's description sounds bad enough, but you have to see one to appreciate his seizure's severity. Namdi's seizures have made school and sports very difficult and even affected his personality.
He's more reclusive, as you could tell. He's you ask him one thing, he goes into other things, and he cannot concentrate for more than an hour.
Medications have not controlled Namdi's seizures, so he's decided to try a surgical approach. It's a battery-powered pacemaker of sorts. During a one-hour procedure, Dr. Ashish Mehta places a small electrode around a nerve in the neck called the vagus. Then sensors watch for an early sign of an impending seizure.
The heart rate goes up suddenly, right at the time when the seizure is about to begin. This device senses that heart rate, and when that happens, it delivers that stimulation to the vagus nerve, thereby reducing the chances of a seizure getting worse. Let's see it.
We were there when Dr. Mehta turned the stimulator on for the first time. Namdi said he only felt a slight tingling. The stimulator will be turned up over the next 6 months with the hope of dramatically reducing the amount of medicine it takes to control his seizures, and in some cases, even eliminate them.
The whole Namdi can come back. He's a good boy, and I can't wait to have him back.
Not everyone gets dramatic results, of course, but in clinical trials, half of all patients cut their seizures in half, a huge improvement in quality of life. And as an added bonus, vagus nerve stimulation has also been shown to reduce depression and improve mood. It's actually used sometimes just to treat depression all by itself.
Wow, exclusive of any others.
Yep, having nothing to do with epilepsy.
Wow.
Well, I really hope that it helps this young gentleman. I feel bad because his childhood has been robbed because of his condition.
It really has, and he could tell he was such a nice kid and really wanted to do well, but this thing just blocks him, and so hopefully he'll get better. He'll know in about 6 months as they ramp up the stimulation.
Hopefully.
All right.
Thank you, Dr. Max.
You bet.